Welcome back to the Black Doctors Talk podcast. I am Dr. Christopher Holmes, host for this episode and member of the Black Doctoral Network. Today, I am joined by Dr. Jacquelynn Hairston, who is an advocate, entrepreneur, and public health expert that serves as a Human Services Analyst. Welcome, Dr. Hairston.
Well, thank you for having me here, Dr. Holmes. I'm excited to be here with y'all and hopefully be able to expound on what it is I do. But thank you very much for having me.
Thank you for being here. I'm excited to have you here, and I'm excited for you to share with our viewers and listeners. So let's go ahead and get started. Tell them a little bit about your background. Where does it all begin for you?
It began, believe it or not, probably about the time I was about 5 years old. It was very easy for me to see the world around me. I was more profound with that than most children are. But the one thing that got to me was I had a classmate or whatever that we were in kindergarten at the time, and I noticed that she didn't have enough to eat. She was always unkempt, and it bothered me. And I would tell the adults that I knew, hey, what do you think we can do to help other people? If they're hungry, how do we feed them? If they need clothing, what do we do about that? And so it was me at that point that made a decision to make sure that when I ate, she did, which means I would, take a little food off my plate, give it to her, clean clothes if I had some, wash something, give it to her, slip it out to her. It was not something that I was told to do or allowed to do, but it was something I took upon myself. Being that way caused me to be an advocate. Then I didn't know what an advocate was, but that's where things began for me. I went on. My background is that I've spent 33 years in government, working for different Florida state government and local entities. And it's given me the opportunity to be a citizen for the state of Florida, a good one, but also to help the citizens in the state of Florida. And then to improve my way of affecting their lives. I went to work for a while. Eventually, I started going to college at 39, and then they paid for some of it they didn't. And once I started, I just kept going. So today, I now have I'm a graduate of Walden University. I have a doctorate in public health, and it's an emphasis on community health and promotion. Who knew that I would get a job in the Community Health and Improvement Plan division? But my focus in school was adult intimate partner violence. And for those who don't know what that is IPV. And it was from the perspective of race, income, gender, and age. I wanted to know those variables. What do they do to our community? And understand Black and Brown at the time, just academically on that level.
So just in that short answer, you have given me so many things that I want to know more about now.
Okay.
Oh my God. Okay, so let's just start here. As a young child, you saw this need to advocate. Saw what I hear is you saw the need to serve.
Right. I didn't know that. But my service has led me to when someone, and I'll give you this little tidbit, my children are like that. I don't know if it's something in their spirit, if it's in their bloodline or whatever. My children are that way. If they see somebody down, they are going to stop. It's going to get their attention. And me, we're going to go back and say, what's happening? How can we help you? How can I help you? And that, like you said, moment of service. And so I'm 60 now. So I've been serving for 55 years in one capacity or another without realizing it until I got to this level, dealing with this community, the way they are, especially with COVID hitting them.
Wow. 55 years of service.
Yeah.
Wow.
You don't get paid for that.
Not at all.
That's a whole nother conversation.
But here's the thing. You can't pay people for passion because they'll do it for free.
No. True.
And
didn't
that's
understand
just
that one either.
Yeah.
Yes. And then, like, well, why is she here? This job doesn't make that much money. It's not about you. It's not about this place. It is about when someone calls me, no matter what it is, I'm going to stop and pay attention to them. And if I can't help them, I'm going to find a way to make sure that I get somebody's attention and say, this person needs help. Please, if you can't figure it out, find a way. Let's get something done here, because you just don't. Once you know, I'm understanding, you can't unknow it. Ring that bell, can't ring it. So yeah, that capacity, my thinking is in that capacity.
So let's go now. The next thing you said that intrigued me is that you started your academic journey in higher ed at 39.
At 39.
How was that?
Special. well, let's go back a little bit. So at 5, I also learned, and a lot of things, good and bad. 5 is little children have, so you said they don't remember when they're 3 years old and things happen to them, good or bad, they don't remember. We're finding out now, because I've studied maternal child health too. We find out now that I tell people in my conversations, med school, I had a med school pre-med student who graduated. I went to Atlanta, and we were talking. I said, I need you, while you're out there, I need you to remember, don't start with the mom and the baby that shows up with you. Understand that she carried the baby. Understand that all the environment and the community around them, that baby was marinating in that, and that baby was picking up those traits and those things. And if you pay real close attention, it'll be profound how much, when that child comes into the world, they will follow certain traits or things. It's not just the bloodline. A lot of it is they're listening. That's why you can play a piano or you can play a violin. That baby is born, that baby can remember that. So that type of engagement for me, it kind of gets people like, but then when they stop, if they listen, they go, oh, that was profound. You're right. Mm-hmm. So not trying to be right, just trying to bring awareness to how our environment, public health, our environment, all of it is extremely important. And it's to unravel it, we need to understand that.
Yeah.
And I learned that, didn't learn it in textbooks. I learned that by being knee deep in it, and especially with COVID affecting, it has transformed my paradigms. And I try to do that for the people around me. Like, stop, listen, you're frustrated because these people are asking you to help them. Wait a minute, put yourself on the other side of that. How would you like it if people are yelling and screaming at you because you need to get back to your life? And COVID has affected it negatively.
Yeah.
And they're showing up at your doorstep, public health department, showing up at your doorstep saying, please help me. And they're frustrated because nobody's listening to them. And we just need to take a step back and do that and take a deep breath on top of it. So yeah, it's a lot. It's a lot, but you have, I told somebody yesterday, decompartmentalize it. Look at it from perspective of, we don't have enough people that show up looking like us.
Yes.
And that's a problem for me because of different studies that I do and the different areas that public health takes you to. That's another question down the road, that how do you unravel that? How do you stay on point with it? You do have to pick one or two PhDs in public health. We were taught we had our platforms, they call it. I know that's probably not the word for it, but the things that you love or the things that you want to research in the future when it comes to public health. It's not like I'm an accountant and I'm stuck in that. Like, I value how they educated me coming through the ranks.
Mm-hmm.
All of my degrees base is in social science. Public health is based in social science. Healthcare administration, one of my degrees, social science. Social science degree concentrating in sociology and human and the urban and regional planning. Why urban and regional planning? Because I was at that time wondering how are we impacting our surroundings, whether we're impacting or other things are impacting us. That's why urban and regional planning for me. And then of course my AA started out in criminal justice because I was working for the agency here in town. And I tried to align whatever agency or whatever field I was in at the time, my degrees align with that. Is you don't you have to, something I have to say. Somebody was like, well, I don't have to say it, but I'm saying it explains it. I'm like, well, why did you do criminal justice? And then why did you transition to social science? But criminal justice is social science. It's in that field. So yeah, and I had to align that myself at 39 years old. There was nobody really to guide me once I got to Florida State University. And I had a special advisor because they found out that I was on the spectrum. And why I was having so many problems with my algebraic expressions was because the steps that you have to take.
Right.
And rather than let me suffer and let me drop out, they created a plan to retain me. And some universities will do that. I don't know if people know that, but some universities will do that if they find out about it. So the community college, when they transferred everything, someone took notice of that. So that when I got to my bachelor's program, they gave me a special academic advisor that said, you're 39 years old. We want you to stay. At your age, you get a lot of frustration. You're going to be in there with a lot of young kids. They're coming from home. They've got stuff. They're 17, 18, anywhere from 17 to 24. They're still young. And you got to navigate that. And then we don't want you taking classes that are going to frustrate you.
Yeah.
So, but I carried through, and at 57, took me 17 years, especially with being on the spectrum and everything. It took me 17 years to walk through it. But I'm here, and they can't take it from me.
Oh my Lord. I mean, okay. Let me get myself together. Let me calm down.
Okay.
There is a message of encouragement for somebody in just what you said. 39 years old, starting your bachelor's program. They find out that you're on a spectrum. They provide you with support. Not only do you start and complete the bachelor's, you go on to get a master's, and now you hold a PhD.
Exactly. And they had to give me time to do it, whether they liked it or not. But that's what we talked about earlier. That's when somebody's listening. Well, I'm going to back up a lot and say, I know that the only reason why I got through the things that I did coming along, because there's a bad side to it too, but coming along, the way I got through it, and I'm going to always give a praise to God. Like, I don't care. I was speaking on Saturday and I said, listen, there may be people here who do not believe in it, but find something that you believe in, but know when it comes from me, that is my light, my shine, and my rock. And without him, there's no way the things that people are finding out about me that they didn't know, because I didn't tell that side of my story until Saturday, is mind-boggling. And it boggles my mind too sometimes when it comes out of my mouth, like, whoa, did I do that? Mm-hmm. So to speak. So yes, sir. We don't have enough time here to go into it, but I thank you, like I said, for this platform so that I can hopefully reach someone and they can understand she did that. She went through that. It was humiliating at times. I never told my classmates that I had been diagnosed with a learning disability because I didn't want anybody to feel that I needed special treatment.
Right.
The universities didn't blast it. They can only speak to my professors to say there may be a time when she needs to take a test a little later. She may need a quiet space, or she may need to turn a paper in. She has 7 extra days. And that was not something that I lauded over people or anything. I just took it in stride and did what I had to do, because also my children and grandchildren needed to see that it could be done.
Children, y'all hear that? Children and grandchildren. Just in case somebody missed that. Okay.
Children and grandchildren. Yes.
So do you hear how this thing is very layered? But this woman exemplifies perseverance and resilience. I mean,
thank you.
And we haven't even talked about public health yet, right? Just a little bit. We're just talking about her life. But I want you to understand that the journey to the doctoral degree is not always easy, but it can be done.
Yes.
Barriers, challenges, whatever it is, you can do it. And she's a living witness.
Yes.
Look at her. She's telling you it is not impossible.
Yes.
Take your
Just,
time, be committed, and see it through to the end.
yes.
Oh my God.
And
All
then
right.
reach out to mentors
Yeah.
or people that are in your corner when times get rough. I'm going to tell you a little secret. I went into counseling, crazy story. I went to take one of my daughters to counseling so she could get some help. I just had a baby. I learned about this lady or heard about this lady from my doctor. And I said that my job is driving me crazy. I was in public health and these people were crazy. He said, well, have you heard of Dr. or whatever? And I said, no. When I took my daughter, the mind came back. I went, that's the same doctor, the same, doctor that my doctor mentioned. I'm like, okay. So when I got her out of bed, I talked to the lady and I said, hey, I'm in a PhD program between work and PhD. It is driving me batty. And then I don't want to graduate. And I've had some people on our level that when I was just ABD and a candidate, that I would go up and say, hey, I'm in this. And I want to know, how did you do what you did to get to where you are today? And some of them looked up down their nose. They snobbed at me. How dare you? I mean, they seized up. I was like, whoa, I did something wrong. So what I developed was I did not want to be that person. I wanted to be better. I wanted to be approachable. I wanted to be open. And I also wanted to learn to listen.
Yeah.
And so I went professionally. She was my counselor and my mentor. So whenever I was having issues with my professor's chair, whatever it was, she would say, step back. I'm going to take the counselor hat on. Let me do a mentoring hat now. And then here's how you handle this. And we want you to be professional. We want you to be able to do the things that you want to do and affect people's lives positively. We don't want people to walk away from you with a negativity. So let's work on that. So what I'm saying to your audience is, don't ever be afraid to get some help and help in learning how to be a professional. Because I'm told, I don't know if you know, Dr. Holmes, that a couple of things that was said to me. We'll decide when we let you in. One of my doctors said, well, they're trying to ensure that you fit. Whoa. And I'm saying to my mentor, why can't I just be myself? She said, no. You have to put on different layers.
Wow.
And when you are out as professional, like we and I are talking now, there's a way to conduct yourself. And these are things that maybe some of the parents that people, moms and dads that got together and got their children and said, hey, this is how you do when you're in public. And this is how you can do in your home. But remember, what you do at home, you do abroad. So those are little tidbits I just want to share, in that it's a whole lot of layers. This onion has to be peeled back. But at the end of the day, you'll be proud of yourself when you've done the professional development and you've done the personal development, and you arrived at a place with a person that you like yourself. Because once you can do that, you can navigate, and people will see you and not see you as, you'll see you as, wow, that was pleasant.
Yeah, I love that. Say that again. They won't see you as, but they'll see
you like, oh God, here she comes. Oh, here he comes. It'll be like, oh, and I've seen the difference because, yesterday, one of the ladies was like, Doc, there's a position open. Please apply for it. You'll be our leader. And I'm going, I want my life. I don't know. So just to give you, for your audience, and hopefully that will help somebody, because you have a lot of, when I'm trying to mentor, I have a lot of say, I can't do this. How am I going to get through this? I had those same questions.
Yeah.
I had the tears. I had the moment when I got to my PhD, my last allotment for my student loans. I got to hand in my dissertation to have my professor say, oh, this is good. You ran it through the university reviewer and came back and said, this was like a few days before Christmas and graduation was in January, came back and said, Doc, candidate, we're going to have to do something else. And I just sat on the floor and cried. I was like,
wow.
This is not happening to me. And called my friend and said, you're going across the stage, walk. I'm not going. I don't know if I'm ever going to go. And she said, no, wait a minute. Suck it up. Put yourself together. This is not the end of the world. I don't have to march now. I can march in July when you're going to march. And it's going to be okay. So long story short, I went back to the different levels of research that I had done as far as the regressions. I picked a different regression that I'd already written, wrote the paper, turned it in, bam. So if I had sat there and marinated in my own drama, I would not be sitting here speaking with you today.
Yeah. Pick yourself up, dust yourself off literally, and do what needs to be done.
Exactly. And realize that a whole lot of people are waiting for you to put a hole in the ceiling, put your fist through the wall, and your foot through what should have been the door.
Yep, most definitely. You said something as you talked about mentors that, you have to go and seek help when you need it. And so it's interesting that you say that you now work in public health, where people are coming to you for help.
Right.
So I want to ask you about the community that you serve, especially right now. We're in some very challenging times. What are you seeing that's happening in our underserved populations?
Well, interesting that you should ask me that. The here in town, and I want to I'll pull something here on Dr. Holmes, because I prepared it, but I can't say it to you right now. But here's what we're having: we have COVID issues, and they laid bare. That's not really the word, but you know what I'm saying. They opened up a whole Pandora box on hidden things that were there. Part of most of the population that is here it's a unique situation. So I don't know if you've heard this. We have underserved populations that are disenfranchised right here in Tallahassee. A lot of that is racial health disparities, something that I studied too. COVID, like I said, exacerbated that. And then you have to be able to understand how these issues intersect. Now, I live in Tallahassee. We have the poorest zip code in the state of Florida.
Wow.
One of the poorest zip codes probably in the top 10 in the United States.
Wow.
That's not something, and I can talk about it. They've had summits about it. So I'm not going to do what you call it, disclosure, whatever that thing is. I'm not going to do that, a statement, because this is the truth. And I can send you the data. Because of that, we have the schools in the neighborhoods nearby that are affected. The families, we got homelessness and everything. Now, COVID devastated these people. And the conversations that we're having is to unfold and shine a light on it. We've got a population that's called L.L.C. I don't know if you've ever heard of that. And what L.L.C. stands for is, and I have to read it, asset limited, income constrained, employed. It's a population where disproportionate economic impacts of community development give rise to food insecurity and inequitable housing cost burden. Okay. So let me share a few of the statistics that I was talking about. That's why I said I had to read this more so than just spitting it out. Here, Alice is 49% of Leon County's population, if not more, now that COVID is hit, because I have to look at my statistics a little. Those statistics are published on a state website, what I'm giving you. In 2018, the state average was 33% in that poverty level. Leon County's households in 2018 in poverty was 19%, while the state average was 13%.
Wow.
That was profound for me. So in 2018, household costs were well above the federal poverty level of $12,140 for a single adult and $25,100 for a family of four.
A family of four.
Four. So here's what I'm telling you, and people laugh, and it's not funny. I'm not saying it'd be funny. So imagine this: mommy, daddy, baby and a half. Because what if she's pregnant? Or what is her baby? What if her baby's below 3 years old? So they haven't begun to get in the public schools or private school, whatever. They don't have the ability to do that. That entire family is living off of less than 25,100 more likely, because you got to understand, whenever they make, both parents are working.
Right.
Don't know who's taking care of the babies. But this is the plight in this county, and I'm sitting one block over from that zip code in my health department, and I live one zip code over, a few streets over from this zip code. So it's really that's profound to me. And when I got hired, I was a community engagement specialist, and I was going out into one of more impoverished areas outside, like on the outskirts of the county, where trees were in people's houses. So I'm riding down the street going, nobody lives there, right? And then little kids come running out the house. I got physically ill.
Wow.
And had to leave, because that I couldn't even imagine. As a mother, as a human being, I couldn't imagine that. So that's what public health in my community means. It is forefront. And I know other communities, I'm not trying to put anybody else's down, but it was like an embarrassment for me when I first heard it, that they were having summits. The government was having summits to figure out what can we do as far as all of the different levels that you have to deal with: the early childhood education, the maternal health, HIV/AIDS, just other areas that I deal with on a daily basis, because I'm the community health improvement plan manager for Leon County Health Department, or Leon County itself.
So
the health department.
So with all of those issues, I want to ask, where do you start? Like, what is your one priority? But obviously you can't just have one priority. You've got to have many things going at the same time, right?
They're all going at the same time. There's something called a community health improvement plan. That community health improvement plan, there's one for every county. There's also a state and a federal level plan. So the community, Robert Wood Johnson, I think that organization probably has the federal information from the federal level, but then the state Department of Health has what is called a SHIP, and I mess my CHIP and SHIPs, I mess them up, because I'm saying ship when you sell for the state, but I'm saying chip them like a potato chip you eat for the county. But it's a big deal. I mean, we literally, I believe like in 2015 or so, they went back and looked and said, we absolutely have to begin to plan strategically to deal with some of these issues. Well, we're talking about what I call incrementalism. That's a term I learned in my bachelor's degree while I was in urban and regional planning, which means that our governments give us just a little bit to hush us up, a little bit of money, or a little bit of handling things to hush us up. And I'm not speaking against any government, because that's not who I am. But if you study that academically, it's in the books. So I'm not saying something like I've got some, I'm preaching something out there that doesn't exist. It's the word incrementalism, and it's how, governments handle us. And that's the way it's been. And I've been in government for all those years, and I can see it. A little bit here, a little bit there, and the population becomes quiet, and we go on, and the issues still exist.
Yeah.
Public health is full of that.
So what do you do when the need is great, but the financial support is well below providing the support that the community really needs?
Boy, that's a loaded question, Dr. Holmes. I'm not sure what other government administrations. I'm not sure exactly. I can't attest to what the Obama administration Trump or Biden administration does. Now, up in the forefront, we're paying attention to the Biden administration. With the Biden administration, it may have been from the other two administrations that already got started. I don't know. But what ends up happening is we realize that we have to look at the communities from the perspective of minority health and health equity, and how you begin to the deck is stacked against Black and brown people. They've tried to overlook it, pretend it doesn't exist. It's there. In so many ways. Even myself, as a working in the government and going to get health care, going to the doctor and saying, "Hey, something's hurting me," and so you'll see me because I have one of the prominent healthcare. One of the prominent healthcare HMOs, but you won't see my counterpart because they're not part of that system. It looks like, at least from the Obama's administration, was trying to make sure that people were able, if they can be healthy, they can contribute positively to society.
Most definitely.
And when they don't know what they don't know, and nobody's there to educate them and tell them, then the problem perpetuates. It just continues. Public health, if it's handled correctly, it disrupts the quote unquote as it is, not in my backyard or whatever, but it disrupts the cycle. If someone is in there. So public health officials can't just come to the table from academic or numbers perspective. They have to have some heart too, and they have to have some compassion, and they had to be able to sit back and remember some of those of us who have gotten our education and maybe we're above that, but think about that. Put yourself in those people's shoes, flip it on yourself and think about it. So the public health official, no matter if they're a person that's working on getting a license for a healthcare practitioner, or if they're the health officers or the surgeon generals or the state health, the person that's running the department, they have to have some personable attributes. Yeah. You have to think about the populations that they're serving and decide what is it that I can do to disrupt this. And I came to do that, but I got to find my place. And so learning that, part of me doing the public health and always wanting that degree and hearing them say, once you've got the public health degree, there's a whole lot of things that you can do. And as you've asked me earlier, I began to hone in on what areas did I need to be specific about. Well, it drops in my lap when I'm the community health improvement plan manager, and there's a plan that addresses each of those issues. Mental health, yes, the big deal. We have a wonderful leader here, director of one of the mental health centers, who he talks to me often. He has all these ideas. They've got a plan put in together, and we have a conversation with my director and us together, because that's my job. We say, what have you been doing? How have we been addressing this? Because we've got to do something. One of our platforms now, we got to figure out how to address gun violence. And we got to be able, here where we are, we're always mindful. We always got a lawyer in our ear. We always got to be careful what we say. We always got to be careful what side. We have to remain neutral and walk down the middle of it and still be able to affect positively our communities. And so it's a rough job, but I think I've been trained for it for a long time. So I don't think I can ever walk away totally, but my private endeavors will allow me to be on the opposite side, to consult, and yet still, and really be out there and can raise Cain without them saying, oh, you're a government official, you can't say that, or you can't do that. You know what I'm saying? So we get a lot of that.
You brought that up. So let's just go in that direction with your personal endeavors as it relates to advocacy. So talk a little bit about that. My personal endeavors are, I've
I'm working on building a consulting firm. Right now I'm out and I'm speaking to people, mentoring any man, woman, or child as far as healthcare is concerned, and how they can play their part. Once they learn what their part is, once they're educated on how to handle it, then I can be the backdrop to kind of help them, advocate for them, get in there and have a conversation with the powers that be. Because I've been in public health now since 2006. I started answering the phones and trying to help, and went to being a medical malpractice investigator, a
Wow.
medical malpractice officer. So now I know healthcare from healthcare regulations, and what unlicensed activity and what you should and should not do and say, and what you can attest to and what you have to say. I can either deny or or approve that message, so to speak. But then start going on to learning about other things, other areas, and then now from this perspective, coming into food insecurity was my thing when I started, on to being now managing a whole lot of stuff for the health department, including reaccreditation. There is also a project that we've been working on since 2019, definitely late 2019, early 20, and it's called Resilience Catalyst Project at George Washington University. George Washington University and I think FAB and NACHO, all of those public health, those agencies that govern public health, they came together and they're looking at communities like ours as really having a hard time. They're partnering with the health departments to see what it is that they can do on a national level to try to alleviate some of the stuff. We had to pick a subject, which I talked to you about, Alice, and the cost burden, food insecurities and all that. Those we had to pick down, but we had to really dig down into our soil.
Yeah.
And there's something called ACEs. That's a long conversation for us to have. But to tell you what ACEs is, it is adverse childhood experiences. So whatever happens to a child that does not get the help, mental health, healthcare, or understanding the education, understanding their environment and how it affects them and what's going to happen. If they don't get that, they carry that forward. And the mental health piece is something that all of us should have a right to under the healthcare, to be able to get all that stuff out of our system, at least as much as possible, so that we can be productive and make healthier choices. So that's what I'm doing. And then on the other side, and I know this is probably going a little long, but I'm trying to bring it together for you. Because I am a human trafficking thriver, I don't use survivor. I use thriver, because it says that I've moved past the pain of carrying it with me like a boulder. And then I'm able to now speak to people authentically, show up authentically and say, there's no shame in my game. You want to know what that was about? Here I am.
Yeah.
But I survived to be able to talk about it, which is why I thrive now I want it to be reduced. That being said, I began to put in 2019, just before COVID, my licensure in for a nonprofit in human trafficking, so that I can be the voice for those who have none. And so that's another area. And at 60, they're telling me, oh, we need you to do this and do that. I'm like, 65, deuces, I'm out. I've got my own stuff.
Yeah.
That I want to do for the next 25 years or so. When I'm 110 or whatever it is, I won't have time for trying to be regulated. When you spend your life being regulated, I've done 33 years. I spent my whole life in government being regulated as to what I can say and what I can't say. I just need to move on and say, if it's something coming out of my mouth that you don't like, you can't sanction me. That's where I'm going with this.
Oh my God. I need another hour, but I don't have it. See, you have a great way of teasing just a little bit.
I know you don't have a whole lot of time.
And
so
I want more, but let me say this. I see a book coming out of you,
I'm working on it.
and
I'm
I see a
working on
movie because I hear a story that needs to be shared. I mean, you literally just tapped me on my head just then. I'm not even going to say what you said, but the audience and the listeners, they heard it. But wow, you're right. When people look at you, they would never imagine what
it.
that
Yes,
journey entails.
exactly. That's what I'm being told. And I'm getting to one of my board members. She's no longer there, but I asked her to be the secretary. She said, "You don't need to be. You need to go out. You need to get out. You need to be a public speaker. You are hiding behind your shield, your public health shield." but you're a superwoman at a whole nother level, and
Oh my
you need
goodness.
to go tell that. And I'm like, and then I have professionals. Don't tell people that you're victim of human trafficking. That's gonna look bad on you. Listen, my sister was going through something. She called me and said, "Hey, I know you had an issue with a certain person. And guess what? You fought your way. You were awesome. You got away, but I didn't." And because she didn't, the mentality was, I ended up advocating for her, being in court with her, telling the judge, my experience is nothing like hers, but that somebody needed to be there to advocate for her. Somebody needed to have her back.
Yeah.
And she called me in that little soft voice and said, "Please help me, sis. I need you." And at that point, again, from 5 to somewhere between 16 and 18, I became an advocate. But became the advocate. That was my first advocating for someone who had been injured in that way, and have everyone say that's not true. And even today, I have people who won't look at me, talk to me, or whatever, because they're like, but then you're going to open my closets, and those bones are going to fall out of my closet.
Exactly. That's
And
that's exactly what I thought when you said that. Their
right,
fear is that they don't want to tell their story because they're ashamed.
right, right. And my cousin was like, "Let me say something to you." He's a lawyer, and I love him dearly. But he said something out of his mouth that was profound. He said, "Cousin, this is your story. You can't," because I wanted to sit back and be quiet because I wanted to protect them.
Mm-hmm.
And he said, "Okay, you've done that for 55 years. Cool." Then he told me at the time, about 52 years. Cool. Guess what? Now you have to let that go, and you have to do what you have been called to do. So whenever you're ready, get your head on right. But who cares if it's going to make them look bad? Who cares if they're not going to be happy? Who cares? They don't speak to you now. So
Yeah.
they don't have anything to do with you. That you're off limits to them now. So
Yeah.
you're going to sit in silence, and somebody else is going to suffer in silence. No, cuz that's not what we do.
Yeah. You've considered them long enough. Now it's time for you to consider you.
Yeah. So yeah, I'm here. This is not what you expected, I'm sure. We were talking public health, but that's
And we
public
still are.
health.
We still are.
Yeah, that's
Still are.
that was my way. That if it was my one, it was not my one and done, because I've had people come to me. We understand that you have this. I don't have any funding right now, so I can't offer them. I have the things that I want to do for them, but I can talk, and I can say, if your child is in trouble and this has happened, they can come talk to me. Well,
Yeah.
they feeling kind of funny, but okay, well, guess what? I'll break the ice, but when they're ready, let them know the door is open. I'm here to listen. And that's all any of us could ever do.
And see, it is your personality, your transparency, your honesty, your authenticity that we love to have in people that are a part of the Black Doctoral Network. Because
Thank you.
your life, your experience, your expertise, and your relevancy really makes an impact and connects us with each other in such a special way. So talk a little bit about how the Black Doctoral Network has had an impact on you and your career.
Oh man. I can't remember. I think I was still a PhD student, and you get certain offers. I think Walden University, I really appreciate them for that. They are progressive. They're more than people think they are. my experience with Black Doctoral Network is that I listen to the webinars. I try to plug in as much as I possibly can. It's been crazy now, but as a student, I dreamed of being able to go, because I always went to Atlanta, went to the APHA meeting. When they have them in California and all that, I'm going, if I want to go over there. But when they have them on the East Coast, like I went to, I was actually a scholarship winner. I went to Pennsylvania when they had one a couple of years ago, and we had them in Atlanta. And so BDN in Atlanta has been there a couple of times. I'm going, man, I want to go. Sometimes they're right at the same time the APHA is happening. I mean, I'm going, I can't. But at the end of the day, to be honored this way, to be sent an email that said, hey, we'd like to talk to you. I'm going, me? And then when I saw the question, I was going, these questions look like somebody's gone and looked at my background and made these up just for me.
Oh, yeah.
What is going on? So it was like, wow. And then my mentor would say, we told you the universe is proud of you and we know you ready. So I was like, okay. So, you know what I'm saying? But that this opportunity, I think, was given to me as a candidate by the university. They also APHA, they introduced me to that since I was that was my background. And so being able to have those two organizations, and now I've been inducted into the National Society of Leadership and Success. And I was on a meeting the other day about mentoring. I was listening, and I remember when the doctor said, you weren't chosen out of a hat to be a part of this organization. You were chosen. We looked academically, and she wasn't talking to just me, she was talking to everyone there, but we looked at academically how you were successful. And this is the kind of organization that you need to be in. And it's the Walden University chapter. So that was, they've been accredited. I just was flipping through and looking. They're actually accredited National Honor Society.
Wow.
Yeah, I was like, whoa. So between the two, between here with you, this organization and that, I'm going, I can't lose.
Well,
so
congrats to you. That's awesome.
Thank you. I appreciate that. So,
well, I just want to say thank you for taking the time out to talk with me. This has truly been a pleasure. Dr. Hairston, where can people go to learn more about the work that you're doing currently?
Well, as far as the health department is concerned, it's I think I'll try to get it for you, but it's usually Florida Department of Health in Leon County. And then you can go to floridahealth.gov, and there's links, and you can find the county and flip through. Now that'll give you general what our public information officer gives, the information that she can release to the public. So that'll give them. There's a lot of stuff about vaccines, a lot of stuff about COVID, how to get vaccinated, all of that, because I can't push any of it, but I can say it's there. As far as personal, I have a LinkedIn. I don't have it. That's wrong, but I don't have it, but I'll send it to you so you can share it with everyone. A LinkedIn profile that shows my academic and my professional accolades and where I'm going and some of the presentations I've done, things like that. So I'll get that information to you if you allow me to do that.
Yeah, we'll definitely find it. We'll put it down there so people can get that link and they can go and follow you.
Okay. All right. But yeah, that's who I am. And I will continue to do what I need to do from the public health perspective, but also on a personal level, just where I'm needed, I've always served. And that's always been one of my, when I say, why am I here? Why am I doing this? I know that is because God allows these things and he opens these doors. But at the same time, if we're just talking about on a general basis, I have to regroup sometimes when I lose it, as we will sometimes, that spectrum of trying to be up, keeping it all straight. And if I go this way, it's positive, I'm okay. If I go that way and it's negative, it's called straightening and realigning myself. So I'm here, and even anything that I can do for on the Blacktorial Network, you're more than welcome to reach out to me.
Well, awesome.
I'm
Well, thank you again.
always available.
Well, thank you again for joining me. It has truly been a pleasure.
You're
And
welcome.
please be sure, everybody, to stay connected to the Black Doctoral Network and connect with all of our social media channels as well. Thank you for joining us today for the Black Doctors Talk podcast. We hope you will join us again next time. But for now, please be sure to like, share, subscribe, and don't forget to tell a friend. Thanks for joining.